So today we are going to talk about that. So second heart sound. Second heart sound is high pitched sound, and it is produced due to closure of aortic and pulmonary valves. And aortic valve closes first, then pulmonary valve. That's why it has two components, A2 followed by P2. We are going to talk about that later. So first of all, how to say that whether second heart sound is loud or not. So normally what happens, normally we heard S2 clearly in pulmonary and aortic area. And when we auscultate mitral area, the intensity of S2 decreases significantly. It's what happens normally. Now when we say it is loud S2, so what happens in our auscultatory findings? We heard, we hear S2 clearly in aortic and pulmonary area, but we can't say whether it is loud or not just by hearing S2 clearly in aortic and pulmonary area. So we have to auscultate mitral area. So if intensity of second heart sound remains same, then we will call it a loud S2. So next comes in a patient, for example, in a patient you heard loud S2. Now how can you differentiate whether it is due to aortic component or pulmonary component that S2 is loud? So if it is due to A2 loud or P2 component loud, so normally what happens? Normally in both aortic and pulmonary area, A2 is loud, A2 is clearer and loud than P2. Okay. Now if you hear P2 is loud, P2 is loud in pulmonary area, then A2. पल्मोनरी एरिया में अगर A2 is less loud, then it is called P2 is loud, P2 component is loud. And if A2 is loud, the S2 is loud, and it is in its normal way, that both in aortic and pulmonary area A2 is loud only, so then it is A2 component is loud. Okay. Now comes the second important part, A2 P2 split. when we should say that split is present, whether it is wide or reverse. So in normal scenario, if you inspire, then what happens? A2 P2 gap is increased. So normally it is 30 to 40 millisecond. So when you expire, it become less than 30 seconds, which we can't identify whether it is split or not. It is heard as single sound. So normally if you inspire, you heard A2 P2 split. And during expiration, you only heard single sound. There is no split in expiration. This is normal. If you are hearing this in your patient, then you will say that A2 P2, there is no splitting. And what happens? There are three scenarios. So abnormality can be first is A2 P2 split can be wide. We will say wide. It can be variable or fixed. It can be wide variable, wide fixed, or it can be reverse. So how will you identify? So first come wide variable split. If you are hearing split both during expiration and inspiration with normal variation of respiration, then it is wide variable split. Normally we don't hear split in expiration, but if we are hearing it, then it's wide variable split. And what do you mean by normal variation of respiration? That the split is narrows when you expire, and it is get widened when you inspire. Next come the wide fixed split. So if you are on auscultation, if a split is heard both during expiration plus inspiration, but without variation during inspiration or expiration. So it is fixed split. And when will you say this is reverse split? If you are hearing it only during expiration.